The 60s took its toll on inner-city America, and Bridgeport was no different. Industrial decline ravaged the port city, leaving in its wake poverty and a variety of ailments, metaphorically and in reality. The poor and minorities lacked access to health care because few physicians were accepting Medicaid and Medicare. The conditions got worse in the 70s as the working poor found themselves without insurance.
The only health clinic that was set up was in the hospital, like Bridgeport Hospital, but the accessibility wasn't really there, especially for the Latino community.
In 1976, Bull's Head Hollow residents, the ABCD agency, Dr. Norman Block, and others started up the Bridgeport Community Health Clinic.
Bob Grant and Ruth Rodriguez were kind of the pioneers of the BCHC, Bridgeport Community Health Center. They went down to New York and they saw how services were being provided in New York City and the Bronx and a few other areas, and they wanted to have the same services here because there was a great need. There was a lack of access. My predecessor was Fred West, and he had a house on Ogden and East Main.
It was a very small little house, kind of pretty beat up, but it served its purpose. You know, it was the inception took place there.
And we were a storefront operation when I started in 1983.
From those humble beginnings, BCHC provided primary care services. With the hiring of Lud Spinelli, the agency would begin its expansion.
When we got our building here on 471 Barnum Avenue, I think that was really the real key part, that we were able to buy a building. We got 2 National Service Corps physicians. We went from 1 physician to 3.
I came to Bridgeport in 1985 to interview for a position as an internist. There was 1 physician there, a very small group of staff. There was a need for a Spanish-speaking provider.
They were able to bring in Hispanic, Latino staff into the health center, which was a great service to the community.
I saw a neighborhood that was very impoverished. There were high prevalences of diabetes, obesity, high blood pressure, and HIV infection in Bridgeport was just developing.
For the next 20 years, BCHC would continue to expand as the need grew. There was Barnum Avenue, East Main Street, Stratford Avenue, and beyond. The satellite clinics widened the agency's services to include behavioral health and pediatric care. By 1990, the expanded staff was seeing 20,000 visits annually.
They're attracting great staff, people that are dedicated.
Michael Ayala, who was one of the agency's first board members, stepped down when his sister became a staff person 25 years ago, and he couldn't be happier about the way things have turned out.
She is now the director of nursing. She was this year recognized by the Puerto Rican community for her work in the community, and I am just so proud of her.
In recent years, the BCHC has gone back to its roots by opening up the Hollow Community Health Center. Satellite centers today can also be found in Stratford, Bridgeport South End, at the Chase Wellness Center, and in Stanford, where the need continues to grow.
In Stanford and in the surrounding communities, there's a large influx of immigrants that keep coming in, and immigrants that reside in these communities that need access to primary health care. In May 2005, Stanford Community Health Center started its homeless health care program. It received federal funds to initiate these services out in the community. The program has become a very important, vital program in this community because it is targeting those at risk for homelessness and those that are homeless. And since May of last year, to date, we have served over 400 residents. We opened up clinics at the Soup Kitchen, New Covenant House of Hospitality, and at the Shelter for the Homeless.
Bridgeport social activist Angel Reyes says the convenient clinics are one of the agency's attractions.
The community health center is great for this community. It's right in the middle of the east side, right on East Main Street, which is, I think, the heart of the east side.
There are more and more persons nowadays that don't have insurance, and I think that's the biggest change that I've seen.
In order to give comprehensive services, the agency has expanded to provide dental care along with nutritional, chiropractic, and other healthcare services.
Our level of healthcare is better than what a person might get in private practice. So I think we're going to expand our patient base, and we're attracting patients from the Valley as well as New Haven County. In Stanford, we're attracting patients who are uninsured from Greenwich, Connecticut. So even the catchment area, let's say, is getting bigger. We are making strong affiliations with some of the hospitals in the area, like Stanford Hospital and Bridgeport Hospital. Our training of medical students has expanded. So I think, you know, these kind of areas are very important. We have hopes to deal with child obesity and some of the other chronic medical problems that exist in our community.
The thing that's amazing is that there's need, and we're seeing the second and third generation in some instances who are patients, and you know, that speaks well for the care that we provide.
And everybody was so family-like. That's why I'm still here, because that's the way they treat me, like family. He takes real good care of me. He listens to me. That's very important to me.
We look at the whole person, and if any one piece of the primary care pie needs to be addressed, it is.
The BCHC model was so successful, the agency implemented a name change recently to better reflect the future of the organization. BCHC became Optimus Healthcare.
Many people didn't understand why Bridgeport Community Health Center was in Stratford or what we were doing in Stanford, because we had the name of Bridgeport, and we wanted to kind of reflect who we are and what we're doing. And Optimus, as you know, is Latin for the best, and we felt we did have the best model of care.
By gaining this name Optimus, we want people to know that we are striving for the best, to be the best, that we are striving to provide the same care that you would get anywhere else by any other providers.
Despite the success of Optimus, the agency continues to seek out community partnerships and potential resources.
The federal government doesn't give us enough money, nor does the state, to do everything we need to do. FQHCs do work, and they are successful. The outcomes are successful. And if there were more resources, we could spread them around to all the cities that need them.
We need assistance from other organizations in different ways, in methods of letters of support, in direct financial funding, in collaboration.
Spinelli is quick to point out, however, Optimus is very fortunate to have had the help of so many.
We do appreciate all those persons, all of our former board members, our former representatives, former mayors, and others who have supported the health center and understood our concept, because it is a model that does work, and I'm certainly proud to be part of it. And I just can't take credit for all the work that the board and staff has done.
The challenge was there, but thank you to all these great people from way back that were willing to take a chance and make this such a success.